adding soul to the message. As we've dealt with a once-in-a-century pandemic, many people believe that the message of healthcare has missed the mark to the Black community. Is it the message or the messenger? And as we end Black History Month, we'll discuss why it's important that we still celebrate Black History Month itself, our accomplishments, and we have so much further to go. This is Stay the Water. I'm your host, Dr. Eric ClaVille, and we'll be back in just a moment. Welcome back. You're listening to Stay the Water. I'm your host, Dr. Eric ClaVille. We want to thank you for joining us again on this Sunday afternoon. If you've been listening throughout this entire Black History Month, you'll know that we've been discussing the Black church with our partnership with PBS and WHRO in conjunction with the Corporation for Public Broadcasting. It was a tremendous success. You can go back on the website of PBS and you can view that series by the historian Henry Louis Gates Jr. Today, we want to take a look at not just, we're going to combine a couple of things here. We're going to take a look at how Black preachers and African-American rhetoric adds to the message and how we get information out to the community. Now, keep in mind, with the Black church, we talked about a lot of things. We talked about social justice. We talked about economics. We talked about even just building ourselves up through education. But we're going to take a look at it from a different aspect, especially with us dealing with a healthcare crisis. And joining us today, we have a very good friend of mine. He's no stranger to Hampton Roads. His name is Dr. Will LaVeist. Dr. LaVeist, thank you so much for joining us.
Dr. ClaVille, always a pleasure, my friend. Always a pleasure to be with you, man.
Now, again, like I said, you're no stranger to Hampton Roads. You and I, we actually we have a project together that we're doing called LaVeist and ClaVille. You can find it. Yeah, you can find it. It's a podcast, it's a radio show, and we do a lot of interesting things together on that particular piece. We'll talk about it more at the end of the show where people can follow us, and I want you to talk a little bit more about that project. But tell our audience a little bit about yourself and your time here in Hampton Roads.
It's been a minute. I initially came to Hampton Roads as a columnist for the Hampton Roads Daily Press. I was the first Black Metro columnist. This is back in the early 2000s.
Oh, wow.
And then I was recruited to go back to Chicago to Ebony Magazine. And then I was recruited to come back to the Virginian Pilot to lead Mix Magazine, which was a venture startup, the first multicultural publication in Virginia. And around that time, I also, began my radio show. Actually, they were talking to me at Hampton, at one of your sister stations or friendly stations across the water, WHOV. They had been talking to me about doing a radio show when I was a columnist initially. But when I came back, we regrouped that idea. And that's actually when you and I connected. And so, we missed that vibe that we had on the radio and communicating with each other and chopping it up. So yeah, Hampton Roads is definitely a second home. Originally a New Yorker. But Hampton Roads is definitely a second home, and my time as a columnist there and as a writer has been rich and fulfilling. So definitely,
absolutely. And we've talked about on our project, our podcast about HBCUs and the reason why we love HBCUs, and
absolutely.
You're a product of Lincoln University.
Absolutely, the Lincoln University of Pennsylvania, the great state of Pennsylvania, the first HBCU.
And again, don't mistake it with Lincoln University of Missouri, right? But
right, which I have love for. We love them as well, but they're not the Lincoln University of Pennsylvania.
Well, look, we're so glad to have you join us here at Norfolk State University, WNSB. Stay in the Water, where we deal with issues and we bring community leaders, policymakers, movers and shakers to the community to talk about very important issues that's important to them from an African-American perspective. And today, I want to talk about this concept that you've actually created in part, with your academic work called adding soul to the message. Tell us where that idea came from.
Well, yes, it's part of my dissertation. I'm a proud now ODU monarch. I earned my doctorate at ODU, focusing on technology and media studies in the English department. And my dissertation was very much about my passion for the Black community and health, particularly as a reporter and then as a columnist over the course of my years. I became more and more interested in health. And so also being a believer, being a man of faith, I was actually an ordained deacon back in the 90s. I know very much about how critical the Black church has been to the development of Black culture, period. And so the Black church is at the root, from the spirituals to the Black folk church tradition to move to all of the development, all the various denominations. That's at the root of our culture as Afro-Americans. I say
Absolutely.
Afro because we are the people of Africa, like our cousins throughout the hemisphere, whose ancestors made it through that Middle Passage. So in my dissertation, I wanted to look at, if you're going to deliver a message that's going to be effective to a particular people, one of the things you can look at is their own literary traditions and adopt those and use that as a way of forming the message. And so I looked at the African-American Jeremiad literary form, which is a unique form of the American Jeremiad literary form, and how that could be applied to health messaging. And that Jeremiad form, we as people who have been in the church, we're very familiar with hearing it. We've heard it in various different forms. We hear it in church, but it's also been used and played out in other arenas. So if you've heard Dr. Martin Luther King's speech, I Have a Dream speech, or any of his speeches, quite frankly, he used that form.
Now, Will, before we go any further, I want people to understand that we're talking about, when you talk about the Jeremiad style of preaching and messaging, we're not talking about Jeremiah Wright in Chicago, the former pastor of former President Obama and Michelle Obama, but we're talking about the prophet Jeremiah, right? Right.
Okay. Well, yes and no, because you're correct that where it comes from the prophet Jeremiah, who you see in the Hebrew text was lamenting of the people for their turning away from God.
Right.
And so it is that that's exactly what it is that it's this lament of woe, of letting the people know of the risk of turning away from God and not repenting. And so the American form offers that same kind of woe, but it has at its root this hope that eventually people will turn around and repent. And so when you talk about the prophet, you talk about the prophet Jeremiah, and then you talk about Jeremiah Wright. Well, Jeremiah Wright preached in that tradition, of the African-American form, where you hear him lamenting and talking about the grievances that America has done, the wrongs that America has done. But in the end, he always came with that sense of hope, the African-American tradition and our patriotism and our promise, our belief that the country will still do right by us. And so he's absolutely one of the last to preach in that African-American tradition, Jeremiad form. Absolutely.
Now, we're talking about adding soul to the message, and I want to connect that to healthcare. Now, we know that you and your brother, Dr. Thomas LaVeist, who's also the Dean of Public Health, the School of Public Health at Tulane University in New Orleans, Louisiana, my home state. There's a project you guys are working on as it relates to the skin you're in, is communicating issues to the Black community so that they can understand it about their health. We're dealing with COVID-19, right? And the messages have been out there that the African-American community have not been targeted properly. They're not getting the information that they should. And a lot of times we see people that are talking to African-Americans are really talking at African-Americans, right?
Exactly.
As opposed to meeting the citizens or the patients right where they are. So how can, this concept that you have is very interesting. How can the Jeremiad type of preaching or messaging help get the message of healthcare and that message of healthcare, vaccines, how to take care of yourself to the African-American community more effectively?
Glad you asked that, because that's exactly what my dissertation did. I appreciate you mentioning the project, tsyi.org, or The Skin You're In. The website was designed and constructed in that format, in the Jeremiad format with the movements, because again, the concept being, if people of this particular group, in this case, African Americans, see they're literate, the messaging coming to them in a form that instinctively is familiar to them, then they will be more receptive and actually engage in behavior change. And so you're right. A lot of times when it comes to messaging to our community, oftentimes the people constructing the messages are not Black or do not understand the community. So they'll do some logical things like say, well, let's go to the church or let's go to the barbershop. But the messaging is still oftentimes, like you said, it's still not endemic to that culture. So you're talking at the people. And so what we looked at is to say you construct the message in a way that is familiar to the people, so it deals with the issues that we're most concerned about. So the four movements in it is you give an affirmation of the promise, right? The movements in the Jeremiah is that, God promised his people certain things. So you give an affirmation of the promise. You recognize that, people have not turned away from the promise. And then you say, well, if you need to repent or else we will be doomed. Well, the American Jeremiah adds, you need to repent, and then we will repent because God has intended us to be a greater people. What the African-American piece does is it acknowledges racism. It says, white America, you will never, and we will never become a great country unless you do right by us. So when you message to African-Americans around health, you have to think of those same movements, the sense of community, the sense of there's outside forces that's creating this health crisis, the racism that has been totally exposed through COVID, that we get a systemic racism that is still in play, that is plaguing our community. And that is what is the reasons why these disparities and these health conditions exist. So here's what we can do to turn it around and to become a better people.
But Will, you said it's been exposed, right? Now, to African Americans and also to medical professionals, they've always known that these inequities have been there. They've always known that there are the haves and the have-nots. There've always been that as it relates to access to and health care. And I think the message, this is me, I think the message during the Affordable Care Act and that negotiation going back and forth missed the mark. I think it was about healthcare insurance, which is a money thing, as opposed to access to health care, right? So we've always known it was there, but, how is it that the public did not really grasp, that those inequities were there?
Well, because that's the history of African Americans in this country, that there's the country's denial of the conditions in which it has put people of African descent in. And so as long as you don't ever effectively deal with that reality, then you just going about your business in denial. Then you move into other areas of blaming a victim, of shifting the blame to something else. Right. But what we're seeing now and what we're being confronted with is that the remnants of slavery, of the Black codes, of legal segregation still very much remain. We are a segregated society. We have systemic racism. You must address that if you want to have change. And then there's also, in our tradition, there's also been a sense of self-empowerment, self-reliance. That's also a part of the African-American Jeremiah tradition. So, but it's got to be, self-reliance has got to come with the recognition of the systemic racism and the attack that we continue to be under. It's not one or the other, it's both.
Look, you talked about Booker T. Washington, Marcus Garvey, and others, the Black Panther movement, and so forth. So, I mean, that's a lot to unpackage. But you listen to State of the Water. I'm your host, Dr. Eric ClaVille. Today, we have Dr. Will LaVeist, and we're talking about adding soul to the message and how that the messaging during COVID-19 and healthcare has missed the mark in the African American community. Is it the message or is it the messenger? 757-823-9110. Let us know if you have something that you would like to ask. Will, you mentioned that, COVID-19 has exposed these inequities. And I'm asking the question, is it the message or is it the messenger? So in your opinion, your expert opinion, during this time period of communicating both the dangers of COVID, communicating the research around COVID-19, the research around vaccination, and the research around side effects and the research around wearing masks and social distancing. Where did we miss the mark in communicating this more specifically to African Americans? Or did we?
Well, I think a lot of the messaging that is going out is challenged by a lot of the disinformation that is also going on. And that's why my dissertation focused on online and my research looks at online, because what you have going on in the internet space is there's so much misinformation, so easy for people to pass on misinformation that people get to a point where they don't know what to believe.
Yeah.
So what you have is that challenge, unlike, previous generations where the messaging was coming from some particular directions, the press, the airwaves, like shows like these or television. Right now online is the word of mouth that exists in the community, in a physical community. It's another extension of that. And it's actually that word of mouth in your community, particularly for African Americans, that's most strongest in convincing people to engage in behavior change. It's not really what they see on TV. It's not really what we hear on the radio so much, but it's what we hear from our neighbors right in the community, in barbershops, in churches, so forth. Word of mouth is still important. So that's the challenge, as I see it, is so much disinformation and misinformation that's being put out there by people who really don't have an interest for our community, such as the anti-vax movement, using legitimate, distrust of government to actually steer people in a direction that's actually destructive. And again, that's what the Jeremiads of the past did. They didn't cut corners about whether government is distrustful. They say, yes, government is doing this to us, but still, we must, we must hold
take care of ourselves.
That's right. We must take care of ourselves, and we must believe in the promise and that God will deliver us, yet still. But we have a battle that's going on with people who would distract us from that.
Will, you and I, we've talked on our project, LaVeist and ClaVille, about this issue a lot. And, one thing that you brought up is that when you and your brother were creating the Skin You're In project as well, that you were talking to African Americans, you were talking to individuals in the barbershop, in the beauty shop, educated African Americans, right?
That's right.
And there was some information that they were saying that even I was shocked, when you revealed that information. Tell our audience a little bit about some of the misinformation that's going on in the African American community that you discovered during your project and research.
Well, for one, as it pertains to COVID, if you remember in the early stages, people were saying Black people couldn't get it because they were Black.
Yeah.
So Black people couldn't get it. That's just a total misunderstanding of how biology works. And that argument actually feeds the lie of racism, because the bottom line is that there's only one human race, and we're all, regardless of our skin color, which is all about melanin level, we are biologically the same. So to say that Black people can't get a disease is just crazy, and you're actually helping the argument of the racists who would say that Black and white people are different. So that's one of the kinds of things that we discovered. Misunderstandings about diabetes, people calling it that sugar, and having an expectation that they would get diabetes, that is just part of
life. Right.
That's just part of life.
Which is not.
It's like, no, it's absolutely not. If you eat a proper diet, if you are not doing the things that bring diabetes to bear, then you're not likely, not as likely to get it. So it's those types of things, are just kind of accepting things as they are because we don't know. The other thing we found out, again, that you pointed out, is interviewing people on the ground in the neighborhood, is how they are experts in health and in their life and can tell you what is going on and why. And a lot of them had very much knowledge. They were pointing out the things like, why are there no fresh fruits in our communities? Why do we have all these chickens? It's not that it's
processed foods.
Why are all these processed
liquor stores?
Exactly. So it's not like it's something wrong with a chicken fried chicken spot in your neighborhood, but why are there such a plethora of those? But then there's not fresh fruits, there's not supermarkets where you can actually eat healthy foods. So these are the types of things that, folks in the neighborhood are experts in respect as the researchers. And that's how we presented it in the documentary as well.
In politics, we always say that you can always have a new leader or new elite, but you can never have a new grassroots. In other words, the foundation of your support of your organization is not going to change, as it relates to those ideas, the ideology, and the like. And I think that's one thing that we've forgotten as it relates to communicating to African Americans. Again, you mentioned the message and how, we're not getting the proper message out to the people. And I think it's also because of the messenger. Now, one thing that we've discussed and we've seen, and that the pandemic has also uncovered, is that when we're talking about African American or quote unquote people of color, right? Mm-hmm. That's the N word word now, where we talk about is inclusive of African Americans and non-African Americans, but anyone who's non-white, right? Or anyone who does not have access, right, to what money and education can give you. But the messengers to people of color have not often been African Americans.
Right.
It's been a lot of East Indian doctors. There's been a lot of white doctors. There's been a lot of physicians who have had experience treating African Americans, but they have not been African Americans. Now we're starting to see that change a little, especially with some of the physicians that we have here in the Commonwealth. But that's an issue.
It's a huge problem. I think the last stat I saw was like there's 5% of the physicians in the United States are African American. Well, we're 12, 13, maybe 15% of the population. I mean, we have Black colleges, we have medical schools, we have people who are going to majority white schools. I mean, so clearly we can compete in any arena, and the Black schools are certainly not inferior. So you have to wonder what is going on. And again, if you don't have people who are actually intimately familiar with your community and can share that concern, then you're going to run into you're going to see these disparities. So you've got all these studies coming out where doctors treating African Americans but having such devastating misconceptions about African American people, like things like our level of pain tolerance is higher. So we end up getting different prescriptions for things that other patients would need and would be adequate to achieve better health. So absolutely, we need more doctors. So in these listeners, young people who are listening, we need more people going into professions such as health, other professions where our people are, because we need more people who understand who we are. And then we need people of other cultures to make those extra steps, those extra leaps to understand our culture. Just like we, just to function in this country, have to understand other cultures and be able to behave appropriately. But it seems like for African Americans, again, that standard is somehow not needed. It's like you believe you can just treat us in our community without really understanding. Right. You don't really have to understand us. And if we don't respond to the treatment, then somehow it's our fault. No, it's your fault that you haven't taken the extra step as a servant to understand who you are serving. That's where it's at.
Absolutely. And you mentioned more Black doctors, and I want to give a shout out to our HBCU medical schools that have been standing tall for decades and really not getting the recognition. Meharry, in Tennessee, Howard University School of Medicine in DC, and the like. And now you have Morehouse School of Medicine in Atlanta. And a while back you had Xavier University also had a medical school before it closed down, but that was several decades back. So
and now you got public health schools. I mean, you all are developing public health schools are vitally important too. They have different functions, but they're addressing the same issues.
Absolutely. Absolutely. As a matter of fact, it's a partnership between EVMS, ODU, and also Norfolk State University for a School of Public Health in order to get more African Americans into healthcare fields. Again, it's not so much being a physician or being a surgeon, but it's also being a public health official, and oncologists, where we have also researchers and the like, because this is where behind the scenes, where we say the rubber meets the road, where you can really make a lot of change on the ground level, and then through execution, right? Through acting physicians, that's where we actually can give the hands-on care to people. So we're closing that gap, and as African Americans, we know about closing that gap. We know about exposing the gaps that's always been there. A lot of them man-made, if not all of them, in holding us back. But again, we shall rise, right?
And you made a very important point about different types of doctors fitting into this box of people of color, and so therefore they should be able to address this community. You've got people of color have a lot of diversity within them. And
absolutely,
and the subjugation of Black people, Black Lives Matter is a global movement. So you can't, it's a global problem in India, in Pakistan, in China. So it's in all of these places. You got more Black people down in South America than you have in North America who are suffering.
Absolutely.
So you can't just take a doctor who is coming out of that cultural context, right, where he's used to subjugating Black people, or she's used to subjugating Black people, and then put them in front of a Black patient and think that they're not going to act based in their cultural context. So we need doctors to understand who they're treating. And there are plenty of doctors who have taken that extra step. There are plenty of white doctors who have said, I'm going to respect my patient, and I'm going to learn my patient, regardless of what their background is. And I'm going to become culturally competent and treat them in the way that they need to be treated. And that's what we need. Take the extra step. And we also need more Black doctors, as you said.
Absolutely. Well, we've got a minute left, and this has been intriguing for me, and I know our audience has loved it. But I want you to take the last few minutes to talk about our project that we have together, LaVeist and ClaVille.
Yes, absolutely. I'm enjoying it. Again, I remember we first connected when I was doing a radio show on the other side of the water. And I think the connection that we had and then the times that we enjoyed a Barbara Ham Lee's show together.
Absolutely. Shout out to Barbara Ham Lee, Lisa Golly.
And Lisa, we love them. And I just think that, we were always thinking in the back of our minds, the opportunity came to talk about these issues that we both share, and we both present them in the same way. And what we want to do is, as academics, as people have these extra letters after our names, is be able to talk about these complex issues in ways that everybody can understand. Because at the end of the day, we are both brothers from the hood. I'm from the northern hood, you're from the southern hood.
That's right.
We have never forgotten where we come from, and we love our people, and we respect our people, whether they have all the extra degrees or not. So that's what LaVeist and ClaVille is all about. LaVeistandClaVille.com. Check us out and blow it up.
And catch us on social media. Will, adding soul to the message. Is it the message or the messenger? Thank you so much for giving us that perspective about how we can communicate better to the African American community.